Metrocare, Dallas County's largest provider of behavioral health care, managing intellectual disability and primary care for services for veterans and their families, needs some care of its own. Urgent financial care. Parkland Health System may be the answer. Fox 4 Shaun Rabb broke this story 2 weeks ago. He's in now, and Shaun, you've got new information.
Indeed, board members at Parkland and Metrocare are considering the possibility of going forward in a way where the two come together, with Parkland treating Metrocare's business model while Metrocare continues its mental health work. Dallas County Commissioner John Price says an influx of money, though, won't save them, and that Metrocare has got to, in his opinion, make major changes. The behavioral health provider is in financial distress. Operating revenue deficit is more than $7 million year to date, and June operating expenses 19% below expectations, with little or no cash flow on hand. Estimates are Metrocare needs $10 to $15 million right now just to keep going. But that is not the needed financial fix. Dallas County Commissioner John Price says giving money to the problem won't save the mental health provider, and that Metrocare has got to, again in his opinion, make major changes.
There are a lot of issues here, and the infusion of cash does not clear the deck.
When you say they need an overhaul, what are you saying they need to do and what they need to get rid of?
They need to reorganize. They need to reorganize and say, hey, we're going to deal with intellectual, disability, and whatever percentage of their 55,000 population that is, where it's 15, 20%, 30%, doesn't matter. That needs to be their specialty.
And Mr. Price says other mental health treatment should then be turned over to the North Texas Behavioral Health Authority and let that group contract with others in the community to provide that mental health care. But Dallas County Judge Clay Jenkins, while acknowledging the financial stress Metrocare is under, sees a way where Parkland Health System can come alongside Metrocare and benefit from the partnership as well.
There's clearly a financial crisis for Metrocare right now, but I believe there's also an opportunity for the patients at Metrocare. 55,000 people, Shaun, so a lot of patients there, largest in the county. For those patients to have a great experience, and for Parkland to get much needed mental health capacity. So it'll be good for both patient populations. So I'm asking those two to look at potentially an affiliation agreement. I think what John and I would agree on is if Metrocare continues with the same management plan, if they continue, they're not going to succeed, right?
Difference is Judge Jenkins thinks the answer is Parkland's management over Metrocare's finances, and Metrocare continuing as it is. Price agrees Metrocare needs new management, but not, he says, Parkland. And he says they need to scale back to their primary purpose, treating the symptoms of intellectual disability. So late today, Parkland's board voted to provide up to $18 million to keep Metrocare afloat and to look further to determine what needs to be done to get Metrocare back on its financial feet. The #1 needs assessment in Dallas County is mental health care. Metrocare tells me in an email today that they have to meet with their attorneys and discuss Parkland's proposal in executive session, and that'll happen later this week at the Metrocare board meeting.